Hello, welcome to Veteran Voice. Glad you joined us for today's show, and we've got some special guests, as I always tell you that we do, but we've got an information program today that I think a lot of you will find very informative and a good time to watch. We've got a couple of representatives here from the VA Marion Hospital up in Marion, Illinois. We've got Becca Shinneman, is it? Shinneman, I'm sorry, and Mark Speers, who drove all the way down here and got caught in the rain and a traffic jam, but they got here, and we're going to do a half hour today just giving some information to the veterans so that maybe some questions you fellows have might get answered without having to make a phone call. Welcome both of you to the program. Thank you for coming.
Thank you.
Becca, why don't we go ahead and start with you. Let us know basically what your title is and what type of responsibilities you have up at the hospital.
I'm the Community Affairs Officer for the Marion VA Healthcare System, and our healthcare system, I'll tell you a little bit about our healthcare system, and that kind of describes my job. I do public affairs and public relations, and am over the volunteer program, the transportation program, and patient advocates. One of the things, our healthcare system covers 3 states. It has southern Illinois, western Kentucky, and southeastern Indiana. And so without our outpatient clinics, we couldn't provide the services to our veterans. And the Paducah clinic is one of our outpatient clinics in Kentucky.
Okay, so you do a lot of dealings with the public then.
I work a lot with our public, our stakeholders, our congressional offices, and doing information like this. One of my jobs is to work with media and get outreach out there.
Good. And Mark, what's your title? What responsibilities do you have up there?
I am the enrollment coordinator and do a lot of the eligibility and stuff for the veterans when they're at the facility, what they're entitled to, what programs we might be able to offer to them, and work closely a lot of times with the service organizations in the area about pointing in the right direction, about finding claims, things like that. So.
Okay, good. So those are the 2 areas that your expertise is in. We were talking a little bit before we started. One of the things that I really am not clear on is the different classifications of, well, wait, let's start with what veterans are eligible to receive care from the VA hospitals. Do you have to have been injured as a service-related injury, or who all is eligible, and how would they get enrolled into the system?
Well, first of all, there's 8 different priorities within the VA system. Everywhere from service-connected veterans who have service-connected disabilities at 50% or greater, all the way down to non-service-connected veterans who do not draw disability from the VA. Presently, veterans who do not draw disability from the VA are required to do a financial interview. It's called a means test. And at the present time, there are some restrictions on individuals like that that may have a higher income. January 17th, 2003, the Secretary of the VA, along with Congress, enacted a new guideline that said that if veterans who do not draw disability from the VA and had income above the threshold limit, they would not be eligible at the present time to be seen at a VA facility. We encourage individuals to go ahead and contact us. Let us work with them any way that we can to try to get them in. There are ways to get around that, and we could work with them if we could. For instance, Vietnam era vets who served in Vietnam, those people are grandfathered in. They do not still have to meet that financial thing. So there are ways that we can do that. Purple Heart recipients are another individual that are put in a different category. VA pensioners that draw supplemental income from the VA, they're non-service connected vets, but they still would be eligible. So there's ways that we can work with them and try to see what we might be able to do.
So the best way to find out if they are eligible to be enrolled in the system is to go ahead and contact you all.
Absolutely.
And then you can do whatever interviews or
Right.
Forms need to be taken
Absolutely.
care of. All right, now as far as the 1 to 8 categories, is one like the most severely disabled or service related, or just can you give us not a in-depth breakdown, but just kind of a ballpark of the 1 through 8 categories or priorities?
Priority group 1s are service-connected veterans at 50% or greater.
Okay.
Priority group 2 are individuals at 30 or 40%. Priority group 3s are POWs, service-connected 10 to 20%. Priority group 4s are VA pensioners, people that draw aid and attendance or housebound status from the VA. Priority group 5s are non-service connected veterans whose incomes are below the threshold level, priority group 6s, goes on down from there. So
Okay.
that's where I'm saying that we need to talk to the individuals about what they can do about income, and work with them about what we can do. A lot of times veterans don't know that they can file disability claims for injuries they may have received in service. And if we can point them in the right direction about getting established with a service officer in their area and help them get a service connection established, then maybe we can get around the financial status, because service-connected veterans are at 10% or greater are not required to meet the financial interview as far as health care.
So there's a lot of different conditions involved, and
Absolutely.
the easiest way to find it, there's no rubber stamp you can put
No.
on there. You need to pretty
Right.
much contact you all, and you can point them in the right direction.
Absolutely.
Okay, Becca, let's talk about, you talk about the volunteer services, which I know that I do a little bit with. I work with the DAV, providing van rides from the Marion Clinic, or from the Paducah Clinic up to Marion. What other type of volunteer services are involved with the VA healthcare system?
There's a lot. One of the things, talking about the DAV transportation program, our volunteer transportation program, we have 20 vans in our healthcare system. And those vans provide the transportation for our veterans who normally wouldn't get there. Also, if you want to volunteer, you can volunteer at the Paducah Clinic. You can volunteer, it can be helping just filing and shredding, answering questions. Or if you want to, you can come up to the Marion Hospital and do inpatient care, helping visit with our nursing home patients too. But following up a little bit with Mark when he was talking about service officers, one of the things I just wanted to point out was the importance of the fact that you have a service officer in the Paducah Clinic on site. There's actually a couple individuals there, and they're one of the gentlemen that come in, Mr. Larry McCullaugh. He is a very, very experienced service officer with a lot of experience. And even if you're not from Paducah area, in the Kentucky area, he can even tell you where a service officer is in your hometown. And that will get you that start on going through the benefits process. They'll fill out the whole forms for you, help you research your records, and that's what their service officer's job is.
Yeah, Ron's been around for long time. I saw him a couple of weeks ago out at the clinic. It happens the DAV office is next to the service officer. And it's occasionally, very rarely, they get a time to come in and say hi and talk for a minute, but most of the time they've got people out there waiting, and they stay busy. But I know Ron, a lot of fellows know him and have got a lot of respect for him.
He's
he knows
very
his way around.
experienced.
Yeah,
Yes,
he knows.
If he knows, yes. If he doesn't know, there's not very many people out there that doesn't.
Good. Now, as far as filing a claim, you would both suggest that's probably the way to go, is with a service officer
check with
versus
the
trying to do it yourself.
I would say so too. I think definitely the first step is to contact the VA and talk to us, and then also get right at the same time talk to your service officer, because they'll do all the paperwork for you. There's a lot of times people say, well, I don't have any records, or I was never in combat, I wasn't hurt. Well, let's go back and look at your whole history, what really you did in the military, what service you were in, what your field was. You know, were you in field artillery, were you a medic, what type of things did you do? And that's what the service officer asks a lot of those questions too. And we also look at that as well too through the VA. You know, what kind of things have you done? You know, what's your income? What's your, you know, did you serve in? Sometimes people don't even realize that they weren't even awarded a letter. An award, say they were recipient of a Purple Heart, never ever received it. So there's a lot of stuff that a lot of people don't realize that they were eligible for, and then you just need to call the VA and find out.
That happened to me, as a matter of fact, when I was applying for some benefits, and the service officer had said that we were going to apply for a DD-215. Now, all veterans know that their DD-214 is the most important document they're ever going to get from the military, and a DD-215, as I understand, is just an upgraded DD-214. And the reason I did it is I was given an award that was not listed on my 214, and I just wanted for the record.
Yes.
And when I got it, I found out that I had 3 decorations on there that I had no idea that I had. So I would encourage veterans to apply for a DD-215 through a service officer. As a matter of fact, the VFW sometimes gets a lot of criticism because they have a very high criteria for being a member of the Veterans of Foreign Wars. You have to have received a certain particular award, and some of these fellows may be entitled to join that particular organization, and they don't know it because their 214 doesn't reflect it, but their 215 does. So we would encourage them to do that. Now, speaking of the veterans organizations, they also, most of them have their own service officers too. Now, do they have a lot of contact with you?
Oh, all the time. Every month, we have a service officers meeting. in Marion, and they come from all of our 3 states. And they'll be from Indiana. A gentleman drives like almost 3 hours to come and visit us, from Effingham, all over Kentucky. And they come and we meet and we talk about services, we talk about upcoming things, construction, new bills, everything. And one of the nice things about it is a great informational sharing meeting. And so we have a lot of contact with our service officers. They're a valued stakeholder in our organization.
So, go ahead, Mark.
Unfortunately, in Illinois, as far as our veterans are over in that way, Illinois has a service officer that works for the state, just about in every county in Illinois.
Oh, really?
And I have a listing of those individuals. We're also fortunate at the hospital to have a Veterans Affairs state office building right next door to the hospital. And there are service officers in there. They're a wealth of information. I usually can call them and say, I have a veteran here in our area from that lives in this area. Who is the service officer I can put him in touch with? A lot of times it's just a lot more convenient for the veteran to go to a service officer in their area. That way, if documentation has to be given or things like that, it's a lot more convenient for them just to go somebody there in their county or something like that. And that's the way it usually works out better for them to be able to do it that way.
Okay. Now, how about families of veterans? Let's say there's a deceased veteran. Are there any? Well, there obviously not going to be any health care needed for a deceased veteran, but are there benefits that their families might be entitled to?
The best place to go to is www.va.gov. The VA's homepage, you can actually go through. It's a wonderful, very user-friendly. And you can go to that website, and it gives them information on burial, the headstones, home loans, everything is on there. And it actually helps you do facility locations and ask questions like, is a frequently asked questions section in there. That's very good. And that can actually point the person in the right direction.
Okay.
Right, and also, if an individual were a service-connected individual at time of death or something to that effect for his family, there are things such as a death indemnity claim that the spouse might be able to file for. If the veteran was drawing a pension at the time of his death, she might be entitled to the survivor spouse pension. Those things are where the service officers come in to assist the families in helping them. Obviously, you know as well as I do that the paperwork the government requires is sometimes mind-boggling, and it's very good to sit down with somebody that knows what's going on and let them assist you in that way.
So if there are veterans or families out there watching today that aren't sure, there's a couple of different ways. They can either go to their computer and go to the website,
That's right.
or they can contact one of the local veterans organizations and contact their service officer or the clinic. So the information is readily available.
Absolutely.
It's just a matter of picking up the phone and doing it.
Right. Absolutely.
Good.
Or they could even contact me if they wanted to, and I'd be glad to put them in touch with a service officer in their area that might be able to assist them.
Good deal. Well, I know that during the program they're going to be putting the 800 number for the Marion Hospital up there, the medical center, I guess you all call it. So that make sure you get your crayons and paper out there so you can write that down.
And they can ask for the eligibility area, or they can ask for the Community Affairs Department, and we'll help you point you in the right direction.
Good deal. Already we've given out information that I'm sure a lot of people are taking down right now. One of the things I wanted to touch on is the clinic here in Paducah. We're all very proud of that, and it does an outstanding job. I know that they've got the best staff they can get in there, but they are overwhelmed by the numbers of the people that are coming in. But I'm familiar with all the folks out there. They're dedicated, they're hardworking, and I want to make sure I got a good word in for them. But besides that, could you talk about the things that the clinic can do versus what needs to be done at the hospital?
Yes. An outpatient clinic is for you and your community. What an outpatient clinic has is primary care services, limited lab like your blood draw, and also one of the things the VA has now is mental health services in all our health outpatient clinic. So that's a wonderful benefit. So the veteran would come there just like you would be out in the private sector, your primary care physician. So you go there to your neighborhood clinic and go to your regular doctor. Then if you needed specialty services, then you would probably be coming up to the Marion facility. There's inpatient services there. There's a different specialty ones like podiatry. Maybe you need something for same-day surgery. So you'd be coming up to the facility just like you would be in the private sector, referred out to somewhere else to go to get your specialty care. A lot of times, though, what happened, I think, is what's so neat about the Paducah Clinic is the beautiful new building. And it moved from the wonderful, we had a great partnership with the Armory there, and couldn't thank them enough, but we outgrew them. And now you look at our clinic, and it's already at almost 7,000 veterans are going there. So it's a tremendous growth since it opened just a year ago. So it's just phenomenal. And they have wonderful staff there. And we have great mental health services and primary care services there at the facility.
Good deal. That's outstanding. Well, I know that everybody there were a limited number of people that would go to the VA the armory over there, and I know that they didn't have a very big facility, but they were working hard, and everyone in the area was excited when we found out about the one here, and it has really drawn the attention, and it's a beautiful facility. They do a good job out there, and we're really happy with it.
Yeah.
Now, one of the things that I know that they've got a big sign right on the front that there's no medicine kept in there, so they can keep the drug addicts from breaking into the place.
Yeah, one of the things that's the VA is a leader in is actually in the pharmaceuticals, and the VA is able to way that they approach it, and their formulary system enables us to get the prices we can and provide the care to our veterans quickly. Then one of the neat things, they can call an 800 number. If their medicine renewed there, they can go onto My Healthy Vet, another website that you can get through the VA gov.gov website, order your prescriptions online or call, and you get them right there to your house. You don't even have to leave your home. What a great service.
That really is good. I know that the health in the system and the help from the system is real good. Years and years ago, there were movies made about.
That's right.
That you all got a real black eye from that. But then again, Hollywood's going to do what Hollywood can do to sell tickets. Sure. And I know that the facility here in Paducah is very clean. The times that I've gone up to Marion, I've been in and out before my appointment time. And you can't go to a regular doctor anywhere in Paducah and have that
And that's
happen.
one of the things that the VA has really strived for in the last 5 years is a change of their whole healthcare system. And yeah, the VA did in the 90s, earlier, even than that, it was not the quality of care that we needed for our veterans. And so they revamped the whole VA. And now they're starting to get that national attention. I just saw something in the Washington Post about the VA. National publications and national stories are actually coming out and saying the best preventative health care out there is the VA, and that's what our veterans deserve. We should always have the best possible care because our America's hero. Reason we're free, we can stand here and do this story is because of our veterans, and so we need to provide that quality care, and that's something our healthcare system really strives for. And shows like this is wonderful to get the information out. And another thing I wanted to share too with you is the fact that someone has a concern. If they say, hey, I want to know about this, or I didn't, can I get this here, or they're just hesitant, or maybe their experience wasn't the best, they need to call us so we can help them resolve the situation, because to provide the quality care, we need to know what's going on. So as always, call us up and we'll help you out.
Absolutely. We have individuals there at the hospital that deal specifically with that. The patient advocates at the hospital are the ones that usually field the concerns of the veterans if they have a complaint or something to that effect. I know that it'll be looked into. I know that it'll be addressed, and they have every right to be able to voice those concerns if they wish about things that they have problems with or something.
So if someone's getting care from the VA and they're not happy with it, or they think they were didn't get adequate care from someone or treated rudely by someone, instead of going out and just talking about how lousy the VA medical system is, they need to call and complain and say, hey, look, this is what happened to me, and you all will address that.
Well, that's right.
Yeah, we want to know about that. But simply because, it could be something that maybe I, as an individual, failed to do as helping them understand something or something that's like that. A lot of that is just, those things are something that we want to know about that would help us be able to get that information to the individuals. And we have dedicated people there at the hospital who can address those things with them and go directly to the source that needs to be addressed and see if they can't resolve what the situation is.
Exactly. It's a process. Sometimes every system out there, maybe some miscommunication to that veteran. Maybe I didn't take that extra 2 minutes and sit down and say, Mr. Smith, this is actually what this means here when we're talking about something. This is a procedure that you means. And sometimes we have that happen to us all the time. And at the VA, we need to make sure that our veteran understands. And sometimes, a lot of the times, it is miscommunication, misunderstanding. And so just going out and being frustrated and quit coming, we want you to tell us what happened. We want to help to resolve it, because a lot of times it can be simply resolved by communication and education to that patient.
Well, and that's the way everyday life is. A lot of problems that occur between people, whether it be in their families or with friends or something else, a lot of times a communication problem, because I'm saying
right.
what I think that you want to hear, and maybe I'm not answering the question, or you're misinterpreting the way I mean
That's
it.
right.
And then you walk out and it's like, well, that guy was rude and he said this to
Yes,
me and that to me.
exactly.
And whereas the intention was not to be rude, just trying to give the information. And then that happens in everyday life.
Yes.
So the best thing to do is just communicate,
That's
call
right.
and get things clarified. Good. That's great. Let's see. Tell me something else that is a frequently asked question that you all get. Is there?
There's been a lot of information that was put out there and limited on for returning combat veterans, and those are individuals that's gone to Afghanistan, Iraq, and their eligibility, and they're able to come to the VA for something that maybe they happened to them over there for the 2 years. And so we're trying to get word out if there's anybody that just got back from Iraq or Afghanistan, they need to check with the VA and see what kind of care they can get for a special mental health screening. It's available for them.
Okay, so the young men and women who are coming back right now. Now, if they're still in the military, then they're covered under the
The military,
military
services. Yes.
Okay, but once they get their DD-214 and they're discharged, even though they may still have some reserve time left
Yes,
or something,
exactly.
at that point they're still eligible to be enrolled
That's
in the
right.
system.
Absolutely.
Because I hear stories here and there about the poor guy, the guys coming back are being treated this way and that way, but I don't see very much documentation on it. Said unless I see something from a respected authority, I sometimes can be a little bit. I'm not from Missouri, but I'd be a little skeptical because sometimes people say something with such, with so much belief in their voice, and it's not true. So the people that are coming back, the young men and women who are coming back, whether they have any problems now or not, they should probably.
Yeah, they're eligible for the care.
Okay.
The
Yeah,
VA.
we encourage them to just, if nothing else, just to come in and enroll. Let us speak with them. There are some other things that they may be entitled to. Number one, obviously, we would talk to them about, did you have injuries or trauma while you were there? And if they did, then we can get them in touch with the service officer so they can get that established. Obviously, the things that we're noticing more than anything else, post-traumatic stress, things like that is something that they can get established through the VA as far as their mental health programs. One of the things that maybe a lot of people don't understand is that as a newly discharged individual, there is a sharing program with the DOD and the VA that says that if the military did not complete their dental care before they separated, if they make application to the VA within 90 days of their separation date, then the VA has a sharing agreement to where they'll go in and finish that dental care. And that's something that's done at the hospital. We have a dental clinic there. It does not have to be done within a 90-day period. They just have to make the application within 90 days. So that is something else that would be available to them. And obviously most individuals that are especially returnees from Iraq and Afghanistan and that, they are not getting dental prior to their separation. So that is something that we can help them with.
And you spoke a moment ago about PTSD or post-traumatic stress disorder. Right. And I know that there's going to be a certain percentage of these people that are coming back who are going to have some experiences with post-traumatic stress disorder because they've gone from their normal everyday life of selling insurance or cars or working at their job, put into a situation where they have seen things and done things that they probably never thought they would in their life. And it's only normal that would affect them. So what I would want to say, and I think you all would agree, is that post-traumatic stress does not mean that you're crazy. It doesn't mean that you've gone off the deep end. It just means that sometimes you have some readjustment problems. And you can't just come out of a combat zone and go back home and think that everything's going to be the same as it was before you left, because that's not the way it is.
That's right.
So if there are fellows out there who just their behavior is different, or families who think that maybe the behavior is different and something that appears to be upsetting to them, they need to go ahead and check into it. It could be that all they just need is some counseling, somebody to talk to, a group therapy thing where they can talk to other fellows who just got back, work things out themselves. It's not something that you need to be ashamed of, but it's something that does need to be addressed.
And that's why we have mental health services in our outpatient clinics, so that our veterans can get care right here. And that's really important for our recent returnees to come in and get that care and get it screening and start maybe this group there, maybe it's individualized, but they can get it in their hometown. They don't even have to drive to Marion, they can get it right there and here in Paducah.
So the best thing for the fellows coming back, or the ladies and gentlemen, I should say both sexes, is as soon as they get back and get their discharge, go ahead and get registered in the system.
Absolutely.
Absolutely.
Yeah, we would prefer
Even
that
if,
that's what
they
they
don't
do.
think they're going to need it 10 years down the
That's
road,
right.
they're already in the
Absolutely.
system.
That's right.
Okay.
Because unfortunately what happened was these individuals that did not enroll prior to this January 17th, 03 date, if they would have enrolled, even though they never wanted to use us, they would not have been caught with this cutoff date. So, you know, that would be an advantage just in itself. Plus, then they would be able to put them into touch with individuals that might be able to provide them even more detailed information about other specific things. One thing I might add, we at the hospital have been going to the family support groups as we find out units are starting to rotate back. There is a family coordinator in our area in Southern Illinois who makes us aware of units as they get ready to come back, usually about 6 weeks out. And she usually then plans a family thing to where the moms and the dads and the wives and different people like that will get together, and I, along with some of our mental health providers, have been going to these family things and helping them understand. You know, don't be surprised if, like you said, if you see something different with your young man or your young woman when they come back. And then, of course, we're making them aware that these things are available to them whenever they come back. Sometimes it helps. The young man comes back to his demobilization after he gets back in country, and you know, he's sitting there listening to some guy go on about this and that and everything, and all he's wanting to hear is just let us go so we can go home. And they miss some things. And if we can go to the families and say to them, you know, be sure that they come out and see us when they get back. Be sure that you help them know that they need to apply for their dental. It helps a little bit, you know, and maybe the wife or the mom and dad are saying, the guy at the VA said you need to do this, you know, maybe you need to look into it.
Good deal. Well, we're down to just the last couple of minutes of the program. Is there anything that we haven't touched on that you feel is important that you really want to make sure you get out there?
I wanted to make sure I mentioned too that if someone would like to volunteer to drive our transportation vans, the vans are free to all our veterans. The vans are actually paid for by donations. And so if they're interested in volunteering, or if they need a ride, they can go ahead and call the 800 number and we can help them out with that too.
Okay.
Only thing else I'd say is just, you know, try to help individuals understand that, you know, that's what we're there for, that we want to service our vets. There's a lot of questions a lot of people don't know and don't understand. And if we can help individuals get to that point to where they can maybe understand the system a little bit better and how they might be able to get service from us, that's what we'd be glad to try to help them with.
Good deal. Well, I really appreciate y'all coming all the way down here today, and we'll do this again sometime. And I would strongly encourage the viewers, you know, we're all waving our flags around and we're talking about how much we support the troops, and we're making the guy who developed those I support the troop magnets, we're making that guy rich. And it's wonderful that we are, because we do need to support the young men and women regardless of what your politics are. We don't hold the warrior responsible for the war. But this is a good opportunity for people to really show their patriotism. Call the VA hospital in Marion, call the VA clinic here in Paducah, volunteer to give up, you know, 2 or 3 or 4 hours out of the 700 and some hours there are in a month. Come on out and help.
Yes.
But thank you all for
Thank
making
you.
the trip down here,
Thank
and maybe we'll
you.
do it again sometime.
Thank you.
Thank you all for joining us today on Veteran Voice, and we'll see you next time.